Hi, welcome to the Cardio 360 video series brought to you by MuniMeterHealth.com. This is Dr. Sharad Jaitly reporting from New York. Um, Today's discussion, I know it's a Valentine's week coming up, so I do want to bring up an important entity which is called broken heart syndrome. I think I do have a video already, but this is part two, and I'm extending even further into details of some intricacies involved in this several parts that work within the engine here. So now you have, just to recap, you have a four-chambered heart. Obviously, the right side is on this side, right atrium, right ventricle, which is connected to the pulmonary artery, sending deoxygenated blood to the lungs. This is a good refresher course for the medical students. Don't forget that, okay? Oxygenated blood returning back to the left atrium, dropped into the left ventricle here, and then it's sent into the aorta to supply the rest of the body. Now, that's in a nutshell the entire circulation, as we know. However, in a setting where a broken heart syndrome occurs, normally one would expect that, it's some portion of the heart has been broken, quote unquote. It is this portion of the heart that's broken. It's the apical portion which starts dilating. Now, on an echo, this is what it looks like. Remember, the heart is inversely represented on the echo when you're doing an apical view. So the right side, obviously, the right atrium will look at the bottom, the right ventricle will be at the bottom, at the top, and so on the left side as well. The left atrium is at the bottom and the left ventricle is at the top. So when the left ventricle contracts, it's the basal portion, which is here. The basal portion actually contracts well, but the apical portion bulges out. You see how it bulges out here? As opposed to here, which is normal. So imagine the left ventricle bulging out like this. So it bulges out here. Now remember, on echo, conventionally the heart is represented, inversely. So just don't get confused, because in real time body, in real body, the heart is situated in this fashion, but on an echo, it appears this way. Having said that, the left ventricular apical ballooning is an issue which is related to akinesia or hypokinesia that develops. As a result, thrombi can develop, or the clots can form here within, and that's very, very precariously dangerous, because obviously these clots, as the ventricle starts improving, they can mobilize or dislodge and traverse through the aorta. And as far as mind can travel, you can imagine how these thrombi and emboli can really go and shower and lodge into the finer capillaries. May it be the brain, may it be the kidneys, may it be the liver, may it be the splanchnic system within the GI circulatory distributions, or even in the legs or in the arms. So these emboli can cause all these embolic phenomenon from here. So that's one of the complications of broken heart syndrome, BHS. We also call it Takotsubo cardiomyopathy. Why? Because in 1990 it was Dr. Sato, I believe in Japan, for the first time defined this Takotsubo cardiomyopathy. By the way, the Takotsubo is an octopus trap, if you will. A lot of the fishermen, they use it, and this is what it looks like. So this way the octopus gets in but can't get out once it's trapped. I mean, that's how it works. But the whole idea is that it's a Takotsubo cardiomyopathy, or broken heart syndrome as we call it. What precipitates this is a very interesting phenomenon. It's normally a sudden release of hormones like the epinephrines. So it's an epinephrine cardiomyopathy, you would call it. So there are numerous names attached to this broken heart. But obviously these eponyms are important, and one should remember that. But the whole idea of the pathophysiology is it's a sudden release of hormones during a fright, anger, or an extreme surprise, or a demise, for instance, in the family. It could be also related to a significant emotional, a bad financial news, or a physical stressor, we call it, like a motor vehicle accident that the person has or some family has gotten into, a significant surgery, either the person himself or herself, or maybe somebody in the family, or even if somebody's admitted to ICU for a major surgical procedure or something of that kind. So that certainly is an emotional stress for the surviving spouse or somebody else. So this is it's a transient cardiac syndrome that involves left ventricular apical akinesia as we call it. And as a result, all of this can develop. Now, having said that, on a cath, let's see. So that's the echo. Now, this is what it looks like on the cath. So on the cath, one would see in diastole the heart is nice and dilated. Well, you can't tell the difference whether the walls are either way showing any contractility or hypokinesia, because the entire heart is dilated, and that's the diastole. That's the relaxation period. So imagine a dye sitting here, DYE, after the angiogram, and this during diastolic phase, if this was the configuration of the heart, this is what it looks like in systole. Normally it should have looked very small and nice apical, but the apex, you see how it's nicely ballooned? So this ballooning, I've shown it with the blue arrows here, this ballooning is dangerous. Same way here, the ballooning of the left ventricle apex. So it's the apical ballooning that is sine qua non of a cardiac cath or an echo finding. Why? Because the coronaries in general are intact, or they're non-obstructive. So there is no lesion that one could say, hey, look, you can put in a stent there. No, it's mostly microinfarcts, a lot of microvascular dysfunction that's occurring into the myocardium. Those are the etiopathological features of a broken heart syndrome, if you will, on a cath or on an echo finding. Now, once the patient is admitted because of obviously typical heart attack or heart failure symptoms, because even the right ventricle, by the way, can be affected as it progresses. So abrupt onset of chest pain and shortness of breath being the clinical features for the person to present with, the heart bulges, and in a classic heart attack, all these symptoms will be present, but you'll see some coronary obstruction there. EKG will define again the ST elevations, which will be there just like any other heart attack. But obviously the patient needs to be admitted to the ICU or CCU settings. And all medications that you give normally for heart attack, including aspirin, beta blockers, antiplatelet agents, heparinization, because heparinization is really common because is often done primarily to prevent any clots forming in this apical ballooning akinetic area. Because remember that when the blood is very stagnant at the apex, what happens? It clots. So blood should be moving. If anywhere blood stops, you'll have a clot. So this is one of the problems here. So it's one of the complications that can be easily prevented by heparinizing adequately these patients. So these patients stay in this ICU CC settings for about 3 to 5 days, go through an echo, repeated echo, and then angiogram. And then, depending upon how well they're responding, which they do, because unlike a regular heart attack, if you will, they respond well. So the prognosis is good. Why? Because they really did not have a full infarct. They just had a microinfarct, small tiny infarcts elsewhere, all these apical areas. So as a result, this muscle function will return and start looking like this. And when it starts looking like this, as I've shown in the right panel, that's when they get discharged, and then in 4 to 6 weeks or the maximum 8 weeks, they should return back to their full activity status. So I chose this Valentine week as a week to define what a broken heart syndrome is, because normally, Valentine is all about love and heart and affection and truly a closeness. But a broken heart syndrome is an entity that needs to be defined, and which we come across quite often in our cardiology world amongst our doctors, where either it's a breakup from a boyfriend-girlfriend situation, or it's a demise, or it's a close relationship like between a husband and a wife, and suddenly there is an issue, for instance, like a divorce happening, etc. So these things can precipitate a broken heart syndrome, just so that you know. So it's very crucial. Stay together, and of course, keep your hearts intact and active, and and healthy and loving. And I wish you all the best and the best of this Valentine's week. Enjoy your Valentine Day, and have fun, and stay healthy and eat, and be healthy. Okay. Love you all, and see you again in my next video. Please keep watching MuniMeterHealth.com, because that's the website you want to be. And if you like this video, please hit the like button, and do subscribe to MuniMeterHealth.com on website YouTube. Thank you so much for watching. This is Dr. Jaitly.